Hello, everyone. Let us start our journey about the revision to the coming KAPS exam, the first free revision with recent recall. As I mentioned, we will discuss about 15 questions. Common questions came previously. We will discuss the rationale of the answer, complete questions with complete choices. How can we solve those questions? How can we deal with them? And if the question change, how can we do, or what can we do? Let us start with the first question. At any time, if you need to ask, please raise your hand and ask directly, okay? The first question, sorbitan monostearate, is it gives oil in water emulsion, or water in oil emulsion, or anionic surfactant, or cationic surfactant? Firstly, what is the sorbitan ester? Or what is the other name of it? The other name is span. Okay, its other name is span. So sorbitan ester is a surfactant commonly used in the production of the emulsions. It has a hydrophilic and lipophilic properties, but the lipophilic properties more than the hydrophilic properties. This allows to form an emulsion. Which type of emulsion? It is water in oil emulsion. Why water in oil emulsion? Because this span having HLB balance or hydrophilic lipophilic balance with low number. Therefore, it is more oily than it is hydrophilic. Okay, so that the best answer of it is formation of water in oil emulsion. The other emulsifier that form oil and water emulsion, we called it tween. Tween have a high HLB system, so that the hydrophilic character of it higher than its lipophilic character, so that will form oil in water emulsion. The next question. Which increases the risk of pyelonephritis? Okay. Hypertension, hyperlipidemia, diabetes type 2, or male gender. This is one of the questions of previous exams. Okay. What is the pyelonephritis? Pyelonephritis is a type of urinary tract infection that involves inflammation and infection of the kidney. Okay, there is an infection of the kidney itself. While hypertension and hyperlipidemia are a medical condition that can have their own complications. They are not direct risk factor for pyelonephritis. However, the diabetes type 2, known to weaken the immune system and impair the body ability to fight infections, so making the kidney more weaker, okay, and susceptible for the infection. Therefore, the answer of this question is diabetes type 2. Please remember this question very well. It is one of the questions of the previous exams. Okay, let us see the next one. A patient with chronic kidney disease receiving gentamicin intravenous every 12 hours. What is the correct? Is it decrease the dose of gentamicin, increase the dose of gentamicin, decrease the interval to be every 6 hours or increase the interval to be every 24 hours? Also, this is one of the very important questions repeated many times previously. Okay, how can we solve that? Here, the patient with chronic kidney disease has impaired renal clearance. The problem here is with the clearance of the gentamicin and increased risk of drug accumulation and toxicity of the drug. Therefore, gentamicin dosing in the chronic kidney disease should be adjusted according to the patient creatinine clearance and serum gentamicin level. Okay, the dose of gentamicin here should be reduced and the dosing interval should be increased to be every 24 hours, so that here the kidney will exposed to gentamicin only once daily. You decrease here the exposure of the kidney to the gentamicin. Okay, and in this case, you will decrease the risk of gentamicin over the kidney. So directly, here by increasing the interval, we did two things. Decrease the dose. Why we decrease the dose here? Because suppose the dose was 100 milligrams every 12 hours. What happened when you give it 100 milligrams every 24 hours by increasing the interval? What happened here? This dose, the patient will receive 200 milligrams per day, while in this case, the patient will receive 100 milligrams per day. So in this case, you decrease the exposure and decrease the dose in the same time. Okay, this is the answer of the question, why cannot we decrease the dose? By increasing the interval, you already decreased the dose. Okay, is it clear? Adiola asked this question.
Yes.
Okay, thank you.
Yes, sir, it's clear.
Let us see the next one. The conversion from nucleoside to nucleotide is achieved by the addition of what? Let us know first what is the nucleoside and what is the nucleotide. The DNA and RNA formed of bases attached to sugar. This sugar attached to phosphate, either mono, di, or triphosphate. Okay. The base plus sugar is called nucleoside. Nucleoside. The base plus sugar plus phosphate, the complete set, is called nucleotide. Nucleotide. So the difference between nucleoside and nucleotide, this phosphate. So the addition of phosphate will make a conversion between nucleoside and nucleotide. Okay, let us see the next question. Tramadol acts on, also this one is one of the repeated questions. I'll go back to the question of the gentamicin again because I have some questions regarding to this one. Okay, let us finish this one, then go back to the question of gentamicin. Tramadol acts on norepinephrine reuptake only, or norepinephrine and mu receptors, or mu receptors only, or mu, delta, and kappa receptors. Okay? So what is the right answer? It is B. Yes. Tramadol is one of the opioids analgesic that provide pain relief through multiple mechanisms. Some textbooks consider it as an opioid and some are not. But generally, it works through many mechanisms. It primarily binds to mu opioid receptors, so that giving that opioid function as an analgesic, okay, which helps to alleviate the pain. Additionally, tramadol inhibits the reuptake of norepinephrine, leading to increased level of the neurotransmitter in the synaptic cleft, plus its effect on serotonin also. Okay, so it will affect the opioid or mu receptors. It will affect the norepinephrine reuptake and also affect serotonin, increasing serotonin. Therefore, one of the contraindication of it is using of it plus now inhibitors or SSRIs. Why? To avoid serotonergic syndrome. Okay? Let's go back to the question of the gentamicin, because I have some questions regarding to this one. Okay. Some questions asking about why we didn't decrease the dose instead of increasing the interval. Again, here, the patient who having kidney disease or chronic kidney disease, his kidney unable to excrete the drug as usual. So here we may have an accumulation of the drug in the body, which may lead to toxicity. So generally, for the patient who having chronic kidney disease, we should decrease the doses, okay? But here for gentamicin or aminoglycoside as a general, we do what? We increase the interval. This is because a patient with chronic kidney disease have reduced creatinine clearance and need longer time for gentamicin to be eliminated from the body. Okay, a longer dosing interval will prevent drug accumulation and reduce the risk of nephrotoxicity and ototoxicity. Here, we decrease the dose and decrease the exposure of the kidney to the gentamicin. Okay, is it clear for all, or still you have a question about this? So the best answer, not only decreasing the dose, the best answer is increasing the interval, which include decreasing the dose. As I described here, if you give the dose, suppose the dose was 100 milligrams every 12 hours, so that the patient will receive 200 milligrams per day. By increasing the interval, it will be 100 milligrams, but every 24 hours. So the total daily dose would be 100 milligrams, not 200 milligrams. In this case, you do two things: decrease the dose and increasing the interval in the same time. Okay?
Doctor.
Yes, please. If you have a question, please. Mm-hmm.
Question, sir. So that means if the option is combined, decrease the dose and increase interval. If one of the options is that, we are going to pick that one that have to do with decrease the dose and increase the interval.
If this is the only option that present which have a right statement, you can choose it. But if you have a comparison between only decrease the dose or only increase the interval or both, what is the best? This is what you ask?
Yes, that means
Okay,
we increase the interval at the first option, decrease the dose at the second option.
let us put those options again to be clear for all of you. First option, decrease the dose only. Increase the interval only. Or both. Decrease the dose and increase the interval. This is what you mean, right?
Yes.
The best answer here is B, increasing the interval. Why? Because this increase the interval includes inside it a decreasing of the dose. Okay? Like this example, again, if the dose is 100 milligrams every 12 hours, so that the patient will receive, normally, the normal patient will receive 200 milligrams per day, right? If you increase the interval, in this case, the patient will receive 100 milligrams only per day. This means that you decrease the dose and increase the interval in the same time by only increasing the interval. Okay, but if you do the following, if you decrease this 100 milligram, which is the original dose, to be 50 milligrams, for example, every 24 hours. This is the option number C. You decrease the dose and increase the interval at the same time. Okay, so that the patient will receive 5 or 50 milligrams per day. A very low dose in this case, okay, which may not affect the infection or may not give the efficacy. Is it clear?
Yes.
Chima asked a question about if we decreased the dose and increase the intervals, this will affect the steady state concentration. Yes, sure. Sure, you decrease the level of the drug in the blood, which may lead to ineffective drug. Okay, so by giving the same dose but increasing the interval, you will make the steady state concentration or make the concentration of the drug in the blood stable to give the effect, and decrease in the same time, you decrease the exposure of the kidney to the drug, therefore you decrease the risk of the toxicity. Okay, let's see the next question. We stopped in the tramadol, this one. Let us see the next one. Vitreous humor is present. Also, this one present in the last exam. Vitreous humor is present in knee joint, shoulder joint, anterior eye chamber, hormone glands, or posterior eye chamber. We have two fluids in the eye, aqueous humor and vitreous humor. Okay, the aqueous humor present in the anterior chamber, and it is responsible for the pressure inside the eye, so that the increasing of aqueous humor will lead to glaucoma, while vitreous humor is present in the posterior eye chamber, and the vitreous humor is a clear gel-like substance that fills the space between the lens and the retina inside the eye and help to maintain the shape of the eyeball, provide support to the retina, and aid in the transmission of light to the retina for vision. Therefore, the correct answer here is the posterior eye chamber. The next one. In the DNA, if a base sequence is A, G, T, what is the complementary paired base sequence? We have 5 types of bases: adenine, guanine, cytosine, thymine, and uracil. Adenine and guanine are purine bases. What is the purine? This is the purine. 2 rings contain 4 nitrogens. This is the purine base. Okay. What is the other bases? Cytosine, thymine, and uracil. They are pyrimidine. What is the pyrimidine? This is the purine. And pyrimidine, only 1 ring, contains 2 nitrogens. This is the pyrimidine. Okay? Each base have the complementary base. Each one purine will bind to the pyrimidine in the other strand. Adenine have the complementary base, which is thymine if we are talking about DNA, while uracil if we are talking about RNA. Okay. Guanine, the complementary base is cytosine, whatever, DNA or RNA. Also, cytosine, the complementary base is guanine. Thymine, the complementary base is adenine. And also uracil, which present only in RNA, the complementary base is adenine. Here we have a sequence of bases, A, G, T. So what is the complementary? The complementary strand here is RNA or DNA? You ask about DNA. Okay, so adenine will bind to thymine. Guanine will bind to cytosine. And thymine will bind to adenine. Therefore, the sequence of the complementary bases is TCA. TCA. Okay. You joined late, so you can listen to the record after we finish. Okay, so you will find the question number 6 and all previous questions again repeated. Let us see this question. MP is a patient, 60 years old, male, with hypertension. Okay, is to be treated with beta blockers. Drug X and Y have the same mechanism of action. So both of them are beta blockers. Drug X, its dose is 5 milligrams, produce the same magnitude and antihypertensive action like drug Y, which have a dose of 500 milligrams. So what is the right statement regarding to those choices? Drug X is about 100 times more potent than drug Y, or drug Y is 100 times more potent than drug X, or drug Y is less efficacious than drug X, or drug X is less efficacious than drug Y. Okay, the first statement is the right one, because here the dose of drug X is 5 milligrams, will produce the same antihypertensive efficacy like 500 milligrams of drug Y. So it is a much smaller dose of drug X required to achieve the same efficacy. In this case, we are talking about the potency the potency of drug. X is much more higher than the potency of drug Y.
Excuse me, sir.
Yes, please.
In this one, it's okay, like because of 5 milligram and 500 milligram, if we are talking about potency, so also the more potent it is mandatory, like a more potent, it will be less efficacious.
No,
Like
no, more potent. Here he mentions that the efficacy are similar. Okay, both of them giving as
the same magnitude, same efficacy,
as we explained in our lectures, if you remember.
Yeah, pharmacokinetics.
Yes, both of them having EC50, they are similar. Those that give 50% of the efficacy is different, but both of them achieve similar magnitude of efficacy.
Fine, sir. Okay, got it.
The next question. A patient has been prescribed a combination of clopidogrel, 75 milligrams, and aspirin, 325 milligrams. This indicates in patients who have had which condition? ST segment elevation myocardial infarction post-MI with stent, or congestive heart failure, or acute stroke, or transient ischemic stroke, or stable angina. So which condition we can use this combination between clopidogrel and aspirin? For sure, the first one, the ST segment elevation myocardial infarction, is the indication for this combination. Okay, this combination may increase the risk of bleeding, but in this case, we need to give this combination. ST segment elevation myocardial infarction refers to a type of heart attack characterized by complete blockage of the coronary artery. Okay, here we have a complete blockage of the coronary artery, resulting in a prolonged period of ischemia and lack of blood flow to the heart muscles. And post-myocardial infarction with a stent indicates that the patient has undergone a procedure to place a stent in the blocked artery to restore blood flow. So we need to reserve this blood flow by this combination. Okay, we need to prevent blood clot formation and reduce the risk of further cardiovascular events. Therefore, the correct statement is the combination of clopidogrel plus aspirin, indicated in this patient who had or who have had ST segment elevation, MI, post-myocardial infarction with stent.
Sir, in this case, okay, the clopidogrel, that will be like, to inhibit the clotting, deplotted. Yes. And also the aspirin, they will, though it is like MI and it's post-MI, so they will just.
Sorry, your voice is cut. Please ask again.
Yes, sir. Hello. Yeah,
yes,
sorry.
yes.
So the question about this, like, this is just because this is post-MI, that's why we just going for to inhibit any like clotting. So we'll go for the clopidogrel as well as the, yeah.
Here we have two risks. Firstly, the risk of MI, so it may be repeated. Okay.
Okay.
Also, the risk of having a stent. Stent is a device that widens the coronaries. So the possibility of formation of clots over this stent is very high. Therefore, you need to keep the flowability of the blood very high. Therefore, we need a combination of two antiplatelets, aspirin plus clopidogrel. Is it clear?
Yeah, yeah,
Okay.
clear, officer. Thank you.
Yes. We have two questions now. Why not D? Why not D? Stable angina is not an indication for the antiplatelets. What are the medications that can be used for stable angina? Stable angina can be treated by nitrates, calcium channel blockers, or beta blockers. Those are the drugs used for stable angina. Okay. Another question, what is if the aspirin is 75? Okay. The recommendation of aspirin starting from 75 or 81 in some textbooks to 325. Those are the antiplatelet doses of aspirin. So whatever the dose, there is no problem. Okay, so the dose of aspirin as an antiplatelet starting from 75 or 81 in some textbooks till 325. Over that, the aspirin would be as an analgesic anti-inflammatory agent. Let us see this question, one of the calculation questions. Okay, sorry, I have another question about the previous one. Why? Why not D, transient ischemic attack, or even acute stroke? Why? Actually, in both indications, we can use this combination, but which is more critical? The prevention of platelet formation from this indication or this indication, or those two indications. Here we have two risks, the risk of myocardial infarction and the risk of stent. So it is higher in risk than the acute stroke or transient ischemic attack. Okay. In some cases of acute stroke or transient ischemic attack, we can use this combination for short time. Okay, but not like the first one. Therefore, the choice A is the best answer for this question. Okay, is it clear? Let us see this one. If the drug infusion rate is 750 milligrams every 6 hours. Okay, take care about this every 6 hours. And the clearance is 8.3 liters per hour. What is the steady state? It is one of the pharmacokinetic questions. As I mentioned in our lectures, for any pharmacokinetic question, calculation question, what we need two things. Firstly, knowing the formula that we will use very well. You should memorize the formulas of pharmacokinetics very well. The second is take care about the units. All units should be similar. The units of weight, the units of volume, the units of time should be of similar units in order to use this formula and answer the question. So for this question, what is the formula that we will use? Here we asked about steady state concentration. What are the information that we have? We have the infusion rate equal 750 milligrams every 6 hours. Okay. We have also the clearance rate, total clearance equal 8.3 liters every hour. We need the steady state concentration. Okay, steady state concentration in which unit? either gram per liter or milligram per liter or milligram per liter. Let us put it as a milligram per liter. Okay. Firstly, looking to the units. Are the units similar or different? The unit of weight, milligram and milligram, there is no problem. The unit of volume, we have only one unit, which is liter, so there is no problem. What about the unit of time? Here we have 6 hours, and here we have 1 hour. So they should be similar. They should be similar. How can we do that? We should convert this rate of infusion to be every 1 hour. Here we have 750 milligrams every 6 hours. So how many milligrams every 1 hour? So you should divide 750 over 6. 750 over 6 equal 125 milligrams. So the infusion rate now will be 125 every 1 hour, and this is the number that we should use in the formula. So what is the formula in this case? CSS equal R over total clearance. Just a small and simple formula. Therefore, we can divide here 125 over 8.3 to get the right answer, which is 15.06 milligrams per liter. Take care when you choose. Why? In the exam, under the pressure of the exam and the stress, you will get the answer 15.06, and then you will not look to the units. Then you will go to this answer, the first answer you see, and direct choose it, which will be wrong answer. So it is one of the tricks of the exam. Please read the answer very well. Read the units very well. When you write the unit here, you should write it by milligram per liter in order to choose the right answer. Is it clear for all of you? Very easy and simple question, but you may fall down in the tricks. So take care about this question very well. The next one. A cancer patient is suffering from anemia due to his chemotherapy. So the anemia cause is the chemotherapy drug. Which drug is recommended for his condition? Filgrastim, rituximab, iputine alpha, interleukin 11, or iron plus folic acid? Yes. The answer is iputine alpha. Why? For the cancer patient suffering from anemia due to chemotherapy, the drug recommended for this condition is iputine alpha. It is a synthetic form of erythropoietin, which is a hormone that stimulates the production of red blood cells in the bone marrow. It is commonly used to treat anemia in patients either with chemotherapy-induced anemia or in patients with kidney disease, chronic kidney disease, because of those patients also have a deficiency of this hormone. Okay. What about the other choices? Filgrastim, on the other hand, is a medication that stimulates the production of white blood cells, especially neutrophils. Okay, so it is used in the case of chemotherapy-induced neutropenia. What about rituximab? Rituximab is a monoclonal antibody used to treat certain types of cancer and autoimmune disease, but does not directly address anemia or treat anemia. What about interleukin 11, or the other name of it is oprelvecin? Okay, it is not commonly used to treat anemia. It is for platelet deficiency. It is a growth factor that can stimulate the production of platelets, and used to prevent the thrombocytopenia, prevent and treat thrombocytopenia. Okay, what about iron plus folic acid? This combination commonly used to treat the nutritional deficiency of iron and folic acid. Okay, here we have no problem with the iron and folic acid. The main problem is the erythropoietin. Therefore, the right answer will be butene alpha. The next one. The steady state concentration achieved when the amount absorbed equal amount excreted, or the clearance rate more than absorption rate, or infusion rate equal, more than clearance rate, or the protein binding is extremely high. Yes, you are right. When the amount absorbed equal the amount excreted, here we achieve the steady state concentration. Okay. The steady state refers to the situation where the rate of drug administration or infusion rate or administration rate or absorption rate is balanced with the rate of elimination, the clearance rate. It is the amount of drug absorbed from administration equal to the amount excreted. Therefore, the correct answer is A. All the following are enzyme inducers except in the exam, they like the questions about inducers, inhibitors, and drug-drug interaction about this one. So that you should know the list of inducers and list of inhibitors very well in order to answer any question about this. So all of the following are enzyme inducers except carbamazepine, phenytoin, phenobarbital, tobacco smoking, and clarithromycin. Yes, for sure, it is clarithromycin. I put some general points to help you to remember which are inducers and which are inhibitors. First rule, all anti-epileptic drugs are inducers except one. Except which one? We mentioned it in our lectures.
Valproic.
Yes, valproic acid. Yes, valproic acid. So carbamazepine is an anti-epileptic. It is an inducer. Phenytoin is an anti-epileptic, so it is inducer. Phenobarbital, also one of the barbiturates, is an inducer. Okay. Tobacco is an inducer. To which cytochrome do you remember? Also, this is one of the very important questions. Which cytochrome?
Yes. CYP 1A2.
Perfect. 1A2. Okay. Another rule. All antibiotics are inhibitors except one. Which one? Yes, rifampicin. Clarithromycin is one of the macrolides, so it is an inhibitor. Ciprofloxacin is an inhibitor. Metronidazole is an inhibitor. Okay, erythromycin, azole antifungals, all of them are inhibitors. Okay, this will help you somewhat to remember the inducers and inhibitors. Let us see this one. Erythropoiesis take place in kidney, liver, bone marrow, or thymus. Also this one, repeated many times previously. Yes, erythropoiesis take place in the bone marrow. It is the production of the red blood cells. Okay, primarily take place in the bone marrow. The bone marrow found within the cavities of certain bones. which is responsible for production of all blood cells, including red blood cells, white blood cells, platelets. And the bone marrow contains specialized cells called hemopoietic stem cells that gives the rise to differentiate or different types of blood cells, while the kidney play a role in production of erythropoietin, which is an erythropoietic agent, producing the releasing hormone erythropoietin. Okay. The last question today, also this one repeated many times previously. In moderate exercise, all happened except increase cardiac output, increase TPR, which is temperature, pulse, and respiration. TPR is the expression present in the exam without explanation. You will find it without this explanation in the exam. Okay. Decrease blood flow to viscera or increasing diastolic pressure. We are looking for the exception. What will not happen here in case of exercise? Okay. Yes, it is D. Increase in diastolic blood pressure will not happen. During the moderate exercise, the cardiovascular system undergoes various changes to meet the increased demand of oxygen and nutrients. And these changes include increase in cardiac output, the amount of blood pumped by the heart per minute increased during exercise to deliver more oxygen to the working muscles. Okay, increase the heart rate, the pulse, to pump blood faster and meet the increasing demand. Increase systolic blood pressure. Systolic blood pressure, here the pressure of the arteries during the heart contraction, typically increase due to the increase of cardiac output. Redistribution of blood flow during the exercise. The blood flow is redirected from non-essential area, such as viscera, to working muscles to meet their increased demand for oxygen and nutrients, so that the diastolic blood pressure will not affect it. Diastolic pressure, which represent the pressure in the arteries during the heart relaxation, okay, does not typically increase during the moderate exercise. Okay. In fact, diastolic pressure may even decrease slightly due to the widening of blood vessels, the vasodilation, in response to the increased cardiac output. Therefore, the correct statement here is moderate exercise will not affect diastolic blood pressure. This was the last question today. I hope it was useful and effective revision for all of you. And we will continue our free sessions in the next week with the second revision. Also, if you want to attend the full revision, you can register to the website www.newptech.com and contact with us for the complete revision. Okay, in this complete revision, we have 4 complete revision lectures, contain most of the previous questions present in previous exams. We will discuss them by the same way. We will discuss the concept. We will discuss how can we deal with the question if we have another statement or new statement. Okay. Now it's time for you, if you have any question about what we discussed today, we can have 5 minutes to open the discussion.
Hello, Doctor.
Yes. Hello.
Talking about the last question, the question number 15.
Question number 15, yes.
Yes. I asked the question, what is a vigorous exercise?
Mhm.
Is there any way the diastolic pressure will be affected?
Somewhat, not like here in moderate exercise, but may be little effect. Okay, in this case, you will have another question and other choices. But mostly here, he asked about the moderate exercise. Okay.
Yes.
Yes, the revision sessions include exclusive calculation lectures, calculation problems inside the lectures from the previous exam with the same figures that present in the real exam. Question number 6 for Ben. Let's go back to this question. Question number 6. Yes, this one about the vitreous humor. Vitreous humor, we have two types of fluids inside the eye, aqueous humor and vitreous humor. Aqueous humor in the anterior eye chamber, while vitreous humor present in the posterior eye chamber. Therefore, the right answer will be posterior eye chamber. For the complete revision, we cover more than 700 questions from previous exams, included in the 4 revision plus 1 mock test. Yes, some of the calculation problems are repeated with the same figures. We covered them. Okay. If you want to register for the full revision, please contact me. I'll give you more information about that. For a moderate exercise, here we have a question about, does moderate exercise decrease the blood flow to viscera and how it happened? Here, for moderate exercise, the muscles that will do the exercise need more blood flow. So the blood flow will be directed to the muscles that doing the exercise. If the viscera is one of the muscles that doing the exercise, the blood flow will direct it to it. But generally, it will go to the other muscles. Yes, I will share the record of this lecture.
Excuse me, sir.
Yes, please.
Yeah, about today there is no question, but you know, just like about in a group we have some like as we have finished our course, like you know,
Yeah.
so this some calculation we have like you know, even it's solved by you, we have in the, but like you know, unable to understand. Like today I share with one of them, so kindly request to just you know,
just share it
assist
or send it
in,
either in the group or directly to me to give you the answer and explain it.
yeah, I share in the group. It's about
Okay.
that first calculation chapter.
Okay.
Yes, yeah, so kindly just thank
Okay.
you.
You're
Thank you.
welcome. I'm gonna ask a question about, I found the sample of the Australian Pharmacy Council very difficult. Is this the level of real exam, especially with the chemistry? The sample that distributed by the APC or Australian Pharmacy Council have questions from previous exams from 5 to more than 5 years ago. Okay, and those questions will not repeat it. Just say, giving you an example of the questions. Okay. Also, you should take care about the answers. Some answers that shared are wrong answers. So trust yourself. When you have an answer with a wrong statement, or you feel that it is wrong or not true, trust your answer and search about the answer, search about the right answer. Okay, the solving of the sample from Australian Pharmacy Council is helpful, is a very good to help you to understand the types of question. Okay, but as I mentioned, you should take care about the answers.
So these are the papers which I think 4 papers on the website. You're talking about that one, APC?
No, not the paper. The website of the official website of Australian Pharmacy Council distribute the samples of KAPS exam from previous years, from 4 to 5 years ago. And they
Okay.
mentioned that those questions will not repeat it in the coming exams.
Yeah.
Okay, just
Mhm.
for training, just give you the training to the questions or the type of questions that spread it in the exam.
Yeah.
Okay,
So,
they are helpful. They are so helpful. So you should
yes.
solve them. But when you see the answers or the key answer, you should take care because some of them are wrong answer.
Okay. So one last question, like, like we have finished our course and we are going to revise. Also, like, like in our course, which we have finished, like we will repeat and revise about the recalls. Like, there is some, like some other many colleagues, they are like last 5 papers, like, or the
Yes.
recalls.
Yes.
The recalls which is in our course here, it's it's okay, we have done. But is this exact some like the files that we are going to you will suggest, like you will recall specific recalls?
In our revision, I shared the most important recalls, which have a complete question and complete answers, which help you to know the question or the real question. Some recalls present in the files, not with the complete question, and you don't know what is the real one, what are the choices. So may cause a confusion for you. Confusion
Okay.
about what are the other answers. If this answer is right or wrong, you don't know. Okay, so the most important repeat questions are present here.
The one which we are doing this
Yes.
course, like
Yes. This does not mean that you should not see the others.
yeah,
No,
yes.
no. You should see the others, but with caution. You should see the others. They will help you more and more.
Yeah.
But you should be cautious.
Okay, sir. Thank you.
Okay, sir, I have a question that your live sessions for the revision would be like same, I mean on Zoom,
Yes.
or you will give some prepared material only?
Yes, on Zoom. But will be
Okay, so
more questions.
how many classes?
Each one about more than 100 questions. Some of them 110, 120. Okay, 4 classes, 4 complete classes. The first one will be for paper number 1. The second one, a special questions for paper number 2. The third one, mixed questions from paper number 1 and paper number 2 with some collections. Collections like drugs should not be used for pregnancy. Drugs that cause disulfiram-like action, and so on. Okay, collections like this. And the fourth one will contain the most recent recalls. Also mixed from paper 1 and paper 2, but contain the most recent from the last exam, especially the exam of March. Okay, this is the content of the revision, the full revision. Plus, at the end, we have the mock test. Mock test resemble the real exam, formed of 2 papers, like the real exam. And you can solve it like you are in the real exam, so that when you go to the real one, it will be familiar with you.
Teacher, just a query. Those who are a full member already registered, is that a class on June 15 as well and June 19 as well?
Yeah. You are one of our members, so the revision is included in your course. You'll find it present. Okay. Finally, I would like to thank you so much about your attendance today. I hope it was useful one for all of you, and hope to see you in the next revision, and hope a good luck for all of you in your exam. Thank you so much, and see you in the coming revision. Goodbye.
Yeah, goodbye. Thank you.